chances are they might also be on birth control. And if they're on birth control, then they're not having a cycle, right? Birth control actually mimics the male cycle, the male hormonal cycle. It just turns off the cycle altogether and puts in a synthetic hormone that then mimics the male cycle so that we can show up like summer every day and be more productive, right? And just a caveat only, I think it's like 95% of people that are on the contraceptive pill are on it for reasons other than contraception. So it's not even necessarily being used for contraception.
Wow.
Most of the time it's being used to like treat things in the womb that don't actually treat the cause or the root cause. It just stops the cycle from happening.
So to the listener of this program, we're not giving medical advice here, but be very careful what you put in your body, from, whatever it is, big pharma or whatever, because you're literally switching off your divine power. So there's other toxic implications, liabilities that I also very worry about. But it sounds like you would definitely be very highly cautious about doing something like that.
So I'm cautious of anything non-consensual. That's what I'm cautious of. I'm full support of anybody doing what they feel is best for their bodies. And I would always fight for the right to contraception. I think that is a very key part of me having the rights that I have today is because of contraceptions that have given people socialized as women rights, many of the rights that they have to be able to be without child, right? And for many people who are in non-consensual situations, need birth control as a means of contraception. So I think there's everything is complex, right? There's no like black and white answer to anything. I think that everything is very nuanced. And what I do believe is I believe in consent and being as informed and literate of your body as possible to make the decision that is best for you. So when it comes to contraception, oftentimes it's pushed onto us well under 18 years old. A lot of people are put on it at 13 years old for health reasons, and then they're on it for 10, 15, 20 years before they even question it, right? And they're not told all of the side effects that it has. It can actually shrink your clitoris. It can cause mood swings. It can make you gain weight. It can make you lose weight. It can lead to infertility issues. It can lead to bone problems, nutrient deficiencies. It's actually stopping your cycle altogether, and you don't even have to bleed while you're on the pill. They just added that in there for marketing purposes because they thought people wouldn't trust the pill if you stop bleeding altogether. So they created a synthetic time to bleed when you take the placebo pills in between the hormonal pills. That creates a synthetic withdrawal from the synthetic hormones, and that is what causes you to bleed. But that's not actually necessary for the pill to work. So there's a lot of different things that they don't actually tell us. And when we go to the gynecologist with issues, we're often either told that we need to lose weight or go on the pill. There's no actual desire to. It's very, very rare that there's any type of deeper look into how to solve the issue other than to put us on the pill. And the results are today that 1 in 2 people with wombs will have a hysterectomy in their lifetime, meaning 50% of people with wombs are having their wombs surgically removed in their lifetime for health reasons. So I bet you can imagine if 1 in 2 men were having their dicks removed for health reasons, that maybe they would start to question the pill or our practices, medical practices around dick care. So there's definitely things to question and things to trust yourself. And you know your body better than anybody. You know yourself better than anybody. And so if it feels like something ain't right, something ain't right. That's all I'm going to say.
Wow. We are
Yeah.
we are talking with Lexi, aka the Cycle Witch. my mind has been blown since I found out about you a month or two ago, and this is a whole paradigm shift. You can work with Lexi more intimately and really learn this information that will empower you. Just go to thecyclewitch.com or follow Lexi at the Cycle Witch on Instagram.